I think I will just start now. Hello, everyone, and welcome to this third webinar in the webinar series, Advancing Sleep Diagnostics Through Home Sleep Testing. Today, we will be talking about sleep healthcare trends from an industry perspective. And with me today is Ingvar Hjalmarsson, Chief Product Officer for Nox Medical, and he will be talking with us about sleep healthcare trends and how they are seen in our eyes, in the industry's eyes. Obviously, we will have a Q&A, live Q&A at the end of this session, but for the sake of effectiveness, we have actually pre-recorded this session, and I think I'm just gonna go ahead and start that one right away. So I will share my screen, and please don't hesitate to use the Q&A already now, or the chat function. And we will try to answer your questions after the presentation from Ingvar. So I will just find the video right now and welcome Ingvar.
I would like to start this presentation on the top trends in sleep healthcare for 2021 to share with you why we at Nox Medical try to stay ahead of the curve by consistently tracking and identifying trends that can have an impact on our field. It has to do with the fact that we have been innovating in this field for 20 years and have our mission quite clear. We want to advance sleep medicine to help everyone sleep better. And we do that by using our strengths when it comes to technology and innovation to apply it to this wonderful field of sleep. Now, before we go into the actual trends themselves, I want to start off with some macro trends, things that actually have a huge impact on the world that we live in, and especially when it comes to sleep healthcare. This starts with the obvious one. We're living in an age of sleeplessness. People aren't sleeping well enough. Almost half of people report poor sleep affecting their daily activities, and this is starting to have an economic effect as well. It's putting sleep on the economic radar in many countries. And we can see that the cost of poor sleep in the United States alone is over $400 billion a year. In Japan, it's almost 140 billion. This is research by the Rand Corporation made in 2017. So this age of sleeplessness is costing us. The second big macro trend is there's awareness. Increased awareness. With this interesting research coming from Earlybird, which is a mattress company interested in sleep, obviously, there's 5 million monthly Google searches on sleep issues. That's something. Just think about that. That's in the United States alone. And there's no reason to believe that it's not the same in the rest of the world. People are frantically looking for help. And the third macro trend is that knowledge on sleep healthcare is concentrated. We can see from the data by Watson et al. That the numbers of physicians passing the ABMS board exam in sleep has been going down. Now, these numbers are perhaps considered rather dated, but to my knowledge, we haven't seen these numbers go up. We as a field, as the field of sleep medicine, we certainly sit on quite a bit of knowledge, but we need more people to help us out. So if you combine all of these three things together, you combine the fact that pretty much everyone doesn't sleep well enough. People are becoming more aware, and we have this bottleneck in front of us. People aren't finding solutions. What that has all the trademarks of is disruption. So there's one thing for certain: our field is going to be disrupted. By whom? We don't know. How? We don't know. All we can do is we can support the disruption, because this avalanche of people is coming and they will certainly find the solution. Let's help them get there. Now, to help them get there and to try to stay ahead of the disruption, we can use these trends to keep us enlightened and should influence the decisions that we're making, short-term and long-term. Now, for trend number one, could be an obvious one for most of you. Telemedicine is here to stay. In the wake of COVID and distance working, we have seen that the technology is ready for this. People already know how to use this technology. The regulation is flexible enough to support this. And this actually sets the stage for huge efficiency gains, which is why payers are starting to take notice. This will make access to sleep health easier. And it's actually the fact that sleep is just perfect for telemedicine. You don't require big, huge machines, a lot of biopsies to be taken. There's quite a bit that you can accomplish by using even just the current technology that is available in the current clinical protocols. Telemedicine, of course, more about than meeting your doctor over Zoom. There's another aspect of telemedicine, asynchronous or store and forward telemedicine, where we do this asynchronous collection and pre-processing of data, such as biosignals and questionnaires, where we can present those for doctors to assess and interpret those results. We're also seeing telemedicine causing the push from hospitals to homes becoming dramatically faster, as biomedical technology enables now location-independent sleep testing. That means home testing, on the road testing, in clinic, in hospital, ICU, long-term care facilities. This is all in front of us. Now, cloud technology also needs to be ready to support this. That enables more scalable clinical pathways, and the existing infrastructure starts to adapt. We're just seeing the beginning of telemedicine in our field. As we know, we are in the midst of an epidemic of sleeplessness, and if we are to help these millions of people towards better sleep, we must employ new technologies and methods that help us get more done with less. This is one of the key benefits of sleep medicine. The opportunity that telemedicine provides in the management of chronic disease, such as OSA, insomnia, and even narcolepsy, is being recognized by more clinicians and technology providers. Technology creates this opportunity, and telemedicine creates this opportunity for physicians worldwide to collaborate, get second opinions, and enlist expert advice. So this is a space that we should all watch out for. Trend number 2 is that sleep healthcare is about more than just sleep apnea. Now, sleep apnea is tremendously important for patients, for sleep healthcare in general. But sleep is about more than just diagnosable sleep apnea. As we know, there's more than 80 sleep disorders. So the industry now seems to be understanding better how a holistic view on patients seems to lead to better outcomes. We can see this from facts like behavioral sleep medicine is on the rise, where the evaluation and treatment of sleep disorders are addressed partly by behavioral, psychological, and physiological factors that interfere with sleep. So therapies can often combine behavioral approaches with cognitive techniques in addition to the normal means of, or traditional means of sleep apnea intervention. So global trends in Google searches also show that keywords like insomnia are becoming significantly higher than those for sleep apnea, especially in the wake of the pandemic. We can also see some trends in the talk that Dr. Erna Sev presented in this webinar series on the sleep revolution, where there's a push for new biomarkers and a drive to understand sleep apnea in more detail than just the single indicator, the apnea-hypopnea index. So we are seeing beyond the AHI becoming much more apparent than in the past. Now, what means do we have to incorporate true long-term circadian rhythm treatment modalities into regular clinical practice? How can we build better programs and technology to support our patients long-term in their constant quest for healthy sleep? This is a huge opportunity. The inclusion of other medical specialties is fundamental in this evolution of our field. Pediatricians, ENTs, primary care, cardiologists, dentists, mental health professionals, and even allied health is headed into the field of sleep. Collaboration and inclusion should be our mantra as more people start to get an interest in sleep healthcare. Now, the third big trend is that big tech is getting into sleep. That is going to be an interesting space to watch out. And why shouldn't they be getting into sleep? We all sleep. And these forward-thinking companies are all investing in initiatives that affect as many people as possible. We still know so little about sleep. And these companies are looking at ways to have a greater impact on people's lives. Now, even though that we at Nogs have been innovating in this space for 20 years, we still feel that we're just scratching the surface. The amount of data that a single sleep study yields is just incredible. With 2 to 10 gigabytes of data to work with, we know that there's more information to be found than the info we are working with today. We see this trend of big tech getting into sleep through the collaboration that Google is having with the ASM and even ResMed. We can see Amazon investing in this. We can see all of the flurry of the consumer gadgets and wrist-worn devices that are intended to help people understand their sleep better. I believe that big tech's interest in the field is going to have a lot of impact going forward. Some incumbent players may find this move by big tech threatening, but we take a different stance at Nogs. We do believe that with the resources that these companies have at their disposal and the vast knowledge on sleep that the field, our field of sleep medicine has, it creates the stage for some extremely interesting collaboration opportunities in the future. By working together, we will have the most impact. Welcome, big tech, to the interesting field of sleep healthcare. Now, the fourth and final trend that I want to talk about is the data-driven revolution is here. There's no doubt about it. Sleep is a data-rich field. Even though we've made strides in the digitization of our field, we are just getting started. To some extent, we are still operating like we were 30 or 40 years ago when we had analog amplifiers on delivering raw biosignals on paper, and we're looking at them 30 seconds at a time. The only difference is that we're doing that on a computer now. We are just scratching the surface. In recent years, there's been an explosion in the development of multimodal sensors and technologies to promote and monitor physical activity, sleep, and circadian rhythms. Vast amount of sensor data is being generated with potential applications ranging from large-scale epidemiological research linking sleep patterns to disease, to wellness applications, including the sleep coaching of individuals with chronic conditions. There's an amazing article in one of the Nature partner journals on digital medicine that discusses the digitization of sleep healthcare and offers a digital sleep framework. This framework shows how interconnected each step of a data-driven process for sleep is. Now, going through, it starts with the acquisition of data, validating that data, cleaning it up, making sure it's not garbage, storing that data, modeling it, using artificial intelligence and deep learning to understand what kind of information resides within that data. The final step, using heuristics and the discovery of new scientific facts through AI and machine learning, then we can finally apply this to the medical field or even consumer technology. The digitization framework of sleep can facilitate a personalized sleep monitoring experience, empowering people to improve their sleep. Now, finally, I want to share with you the impact that all of these trends are having on the work that we're doing at Nogs, where essentially we create solutions that enable a seamless continuum of care in sleep healthcare, where we are using our capabilities to support these trends and participate in these trends. We're investing in simplified and more accurate biosensors that can be used in mass for large populations. We're investing in cloud technology to support scalable clinical pathways, automation technology, and data science to identify and present new biomarkers that can make clinical impact. Now, there's important people-facing technology that we are investing in that will allow healthcare providers to implement telemedicine in their practice and increase their reach. Service initiatives to take the operational burden of some clinicians. And finally, we're looking at solutions for large-scale collection of objective longitudinal sleep data so that we can better understand sleep and manage chronic disease. So what the future holds, it's our obligation as an organization to the field of sleep healthcare to support it, help it grow, and continue to impact millions of people and help them sleep better. We do that through collaboration. We do that by using our own strengths and collaborating with you, the field of sleep healthcare. And I truly hope that this has been a valuable presentation for you. Thank you.
Thank you, Ingvar. Before we start, I just wanted to let everyone know when I'm going to ask you a question, Ingvar, and I'm going to start the poll at the same time, like we did with the other webinars. But I want to use the opportunity to ask you the same question at the same time as all of our attendees. You mentioned those 4 trends: telemedicine. We are dealing with more than sleep apnea. We have big tech getting into sleep, and the data-driven revolution is here. I want to ask you, and I also want to ask our attendees, have you missed anything? Would you like to mention more trends? Because I gave you a short amount of time, and maybe you would want to address more trends. And the same goes to our participants. Please throw into the Q&A some trends that we might be missing. But Ingvar, I'm going to let you start.
Yes, thank you, Snorri. This is almost an impossible task, obviously, to try to distill so many trends and such an alive industry, to try to distill that into some 4 or 5 trends. So obviously I must have missed something, and I'm really looking forward to seeing some of the input that the attendees could maybe provide. But there are certainly honorable mentions that we need to address, maybe put on the table. Trends such as the drive towards value-based healthcare. I recall some data showing that today, I think it's almost up to 25% of healthcare spending in the United States is through value-based healthcare, where we see this transition from traditional activity reimbursement-based activities moving into more of a value-based environment. Now, there's another trend, obviously hugely important, is the empowerment of patients and people taking charge of their own healthcare. Now, there are technology trends to support that, such as telemedicine, access to information, and really just a cultural shift in the way that people are more willing to go to take charge of their own health. So that's another trend that deserves an honorable mention. And finally, maybe the big connection between mental health and sleep. We can see that with a lot of payers and employers, that they are looking at the mental health and mental well-being of their members of their health plans. And this will make a huge impact in the future. This big and tight connection between healthy sleep and mental health. So these certainly deserve an honorable mention.
Mm-hmm. Yeah, and while the poll is rolling, I mean, please answer the question to the poll. We will.
Oh yeah, there's a few interesting ones here. Maybe to start off, there's a question here on how technology and services will move more sleep testing to the home versus specialized sleep clinics. Now, maybe to start off, the obvious answer is through telemedicine. Telemedicine enables us to essentially bring some of these tasks that traditionally were reserved for hospitals, because you required these big equipment that required a lot of specialization to operate. Through telemedicine, we can, and better technology, we can now, it's more simple technology, we can now push some of those activities into the home and increase patient participation. But this constant battle or constant dichotomy of simplification and accuracy is something that we also have to be aware of, is that there's certainly a big push, and the hunger for more simple sleep testing is there from everyone in the market. And we are even seeing some people making concessions and sacrificing accuracy or even insights to the recorded data just to get a little more simple testing devices. So that's something that we need to be aware of, obviously. But telemedicine is definitely the answer to that.
Mm-hmm. And we have more questions rolling in. I'm gonna wait on getting into the poll and maybe just pick another one here. Do you want to take the next one, Ingvar?
Yeah, absolutely. A wealth of excellent questions here, such as the integration of other healthcare specialties. There's a question here on how the integration of other healthcare specialties is going to be possible. There's lack of training in nursing programs, medical schools, and this is something that we I was alluding to earlier. Is it starts with the mindset of us as the incumbents, that we, whether it's technology or healthcare specialists or the sleep healthcare industry, is that our mindset needs to be open and inclusive, because there's just too many patients to go around. There's too many people suffering from unhealthy sleep. So, and what I mean by that is, how can we use both technology, how can we use communication, how can we use our own, I would say, as an industry, capabilities to bring these other medical specialties and allied health into the space of sleep. It doesn't always have to be just send your patients my way and I will take care of them. Can we as an industry maybe support some of these people through either our own training programs and therefore get and only take care of the more complex cases going forward? That's something that we could take a look at.
Mm-hmm. And it would definitely facilitate and help out with one of the things that you mentioned earlier on, around the bottleneck. I mean, there's a huge bottleneck everywhere because it's few specialists, huge awareness around sleep problems, and a lot of patients that are in dire need of help. I'm gonna end the poll, and I'm gonna talk with you a little bit about the results of the poll now. I hope everyone can see that. Again, I'm asking impossible questions to answer, but it's interesting to see here what trend will have the most impact on today's sleep medicine, in your opinion. It's almost equally distributed between the four different answers that we provided. Can you shed some light on this? Your take on this particular question? What would your answer be, for example?
This is, of course, an impossible question, and I think the nice and equal shift or distribution of the answers just shows how difficult it is to make some predictions like that. So what we can only do is we can look at these trends as a whole and just start to prepare for the eventual disruption, because I truly believe that is truly coming.
And going to the next question, I mean, this is also an interesting one. How well is your operation prepared to adapt to new sleep trends? And it seems like, I mean, not very much answers on the not very well prepared, but it's also spread around. Is there anything the industry should be doing to help prepare for those new sleep trends in a better way?
Well, maybe in a way the answers are pretty biased, I would say. The attendees at this webinar, they're attending a webinar on trends in sleep healthcare. So I would expect that this group is, either from neutral or considering them at least on their way to being prepared. But I think the real preparation has to do with the mindset and the open dialogue. I've been in this industry for a long time now, and I'm seeing a lot of openness, and I'm seeing a lot of excellent conversation, discussion, and research taking place within the industry organization, whether it's in Asia and Europe or in the United States and all over the world. So I think we're doing quite a lot.
Mm-hmm. And this relates as well to the third question. I mean, there has been an ongoing debate. Some say that when the COVID-19 is over, things will just return back to normal. Apparently not, as this poll is saying, things will not return to normal as they were before. Most agree with the fact that we will be shifting more to home sleep testing, and telemedicine is likely to play an important role. And I would actually like to combine this with one of the questions here. AHI seems to no longer be the gold standard to evaluate sleep apnea. How could you combine those two here?
Well, it's sort of, AHI is of course a full in-lab polysomnography, and the AHI is still the gold standard, obviously. But what I think we are coming to realize is that there's again, with the wealth of data that we have in front of us after a single night of sleep, let alone multiple nights of sleep. There is quite a bit of information to be to be found in that, and really looking forward to seeing some of the outcome of the ongoing research. Some of it we are even supporting with our own research efforts as well. But there is an interesting question or a couple of interesting questions here that maybe touch on this subject. For example, on the topic of home testing, how likely is it to spread into the pediatric populations as well? It's a great question, because to begin with, when it comes to OSA in pediatrics, there's not even common consensus as to what that actually looks like. How can we define what that looks like? So I believe that it's going to be with pediatrics in the home. Obviously, parents like to stay with their children, and they want to make sure that they sleep in a natural environment. So I definitely believe that there will be a move towards home testing in general whenever possible, but that requires the clinical proof and the research to support those possibilities.
And I guess what also has to be mentioned is that the reimbursement system has to support that, so it makes sense to operate. And there are some questions regarding that here a little bit. Yeah, where is that one? It's because sleep diagnostic remain expensive and cumbersome. I mean, this is also very important. The payers need to, those that are reimbursing for sleep studies, they need to see the value in doing sleep diagnostic in a large scale. How should we be addressing that?
Absolutely, that's a great comment, Snorri. And again, I tend to speak to the obligations that we have as an industry to be supportive and inclusive. But our obligation is also to prove to payers is that it pays off to invest in sleep. That there is not only through financial means and saving on cost savings in managing chronic disease and other related disorders, but also about quality of life years, and just people basically becoming the best versions of themselves. And that still requires quite a bit of more research to support that claim that we all know as the industry. We all know how important that is.
Mm-hmm. Oh, there are just a lot of questions. You can just pick
maybe a couple of more at least. There's one interesting there on the, what would be the near future for Knox Medical to go beyond the AHI? This has been an interesting topic of ours for quite a few years now. And we, through Knox Research, we have been supporting and engaging in quite a bit of research actually on that topic. We have been looking at ways to see what kind of information is in the normal biosignals that we are used to recording. And we've already seen some of that output. For example, our solution for what we call single body source to help out with a chain of custody solution, where we can actually identify whether it's the same person that carries the Knox T3 and the oximeter. Now we've also seen the output of the Knox body sleep algorithm, where we're predicting whether a person, what the sleep states of the person that carries the T3, just using a normal sleep test. But obviously we need to go beyond that, and we are working on some interesting projects, both when it comes to phenotyping to get to the underlying root cause of what sleep apnea is, with the intent to create more individualized treatment pathways. So this is a space to look out for, certainly.
Mm-hmm. And this is tying to some of the other questions here regarding how does diagnostics, connect to better treatment? How is that? This is one example of how it could be done. I mean, finding the underlying cause of sleep apnea, but what could we be doing, better on the diagnostic end to improve the treatment part?
That's a great question. And I think if there's one thing that we could be accused of at Knox, is that we tend to go a little maybe too deep into the diagnostic part, because this is where our domain of expertise lies. I mean, we're biomedical engineers, the people that work here in the development and the technology team. So we tend to go very deep into getting the best biosignals as possible and providing the best analysis as possible. But diagnostic is just a means to an end. When we we need to take very seriously the obligation that we have in order to present a doctor, a qualified person, to make the best treatment decisions based on the information that we provide them with.
I also see that someone has raised his or her hand. Could you just, for this particular reason, it would be best to guide all the questions through the Q&A function of the chat. We'll just go ahead and try to cover more questions. We have some time left, but let's just take one or two more and then we'll head off. Can you pick?
Absolutely, absolutely. So there's a question there on the report, on the AHQR report published last week in PAP therapy not having an impact on OSA outcomes. Of course, this comes as quite a blow. Now, I have to admit, I've only briefly glimpsed through it, and it's sort of it's a little jarring, that report. It's claiming that we as an industry, we can't really agree on what OSA looks like. We're not really in agreement on what the major treatment modality is, and even if that works. So I'm looking forward to seeing some of the, I know that this industry will take that report and provide some good and well thought out responses to it. But it is jarring, I have to admit, to see that this is the perception of some people, and maybe speaks again to the point and the obligation, yet another obligation that we have as an industry to really prove the relevance of sleep health, why it matters, and what we're doing is actually, it matters.
Mm-hmm. And I guess, I mean, it's important for us on the diagnostic end also to have quality data. And this is connecting to the first, one of the questions here is there a concern with patients relying on a wave of unpublished technologies and apps and the industry losing control of the quality of diagnostics and therapy? This is an excellent point. And I think, yeah, what's your take on that, Ingvar?
Say that again, Snorri. Sorry, I missed that.
Is there a concern with patients relying on a wave of unpublished technologies and apps and the industry losing control of the quality of diagnostics and therapy? And this is connected to the awareness, of
absolutely, absolutely. And whether it's I stand here and I carry my Garmin watch, which claims to prove that I'm sleeping, and Dr. Google is of course there in front of most people. So there's certainly a big risk of people going and finding the wrong information about the right wrong answers about the right questions. So again, I think the solution is in collaboration and inclusion, to make sure that we reach out to those that are interested in sleep and have them join our cause instead of trying to do everything ourselves.
Mm-hmm. I think we still have time for one or two more questions before we close this session. Again, you can pick any you like. We will only take the questions we're comfortable with answering.
I'm reviewing a couple of these, just there's too many of them to go through, obviously.
And just while you're reviewing, I just want to mention, it was a really bad joke. We try to go through all of the questions and answer them separately after the session, and feel free to reach out to us if you want to have a conversation on anything regarding sleep. But yeah.
There's a great question here on which maybe speaks to the interest from other healthcare professionals on sleep. Finding chronic care programs, whether it's for chronic heart failure or COPD, there aren't that many that actually incorporate a sleep component. We all know that a sleep component should be a mandatory part of any chronic care program like that. And the question is does Nox have plans to create such programs where sleep is included? Well, Nox Medical, as a medical device manufacturer, we build tools and technology to enable healthcare providers to essentially set up their own programs. But we are certainly seeing, for some of the more advanced thinkers, of how they can actually either support these chronic care programs, led by other medical specialties through sleep, or including them in their own offering.
Mm-hmm. Okay. And I'm gonna go ahead with the last question here before we close things off, because we have focused a lot on technology, and it's always technology that is leading some trend. But is technology always the answer to solving some of those problems that are in front of us?
Well, that's a big question. Technology is certainly not the only answer or the only solution, but it is a part of the solution. It starts with mindsets. Then it goes into creativity and figuring out what kind of possibilities are there to improve on things. Technology is just a means to an end, obviously, because it's all about how we can get more people towards treatment that actually works, that we can actually treat these chronic diseases that we are living and breathing in. So no, technology isn't always the answer, but it's a part of the solution.
Mm-hmm. Okay, I'm gonna let that be the final words of this. Before I let you all go, I'm just gonna remind everyone to sign up for our expert community. We will include a link in the post that we will send this recording on. We will also have some more information about all of the 3 webinars that we did in this webinar series. Again, I want to thank everyone that attended. We had a lot of people attending with great questions, and if you have any ideas on our next webinar series, interesting topics, please feel free to reach out to us. Use info@noxmedical.com and in subject line use webinar. We are happy to hear from you. But I'm just going to close this webinar series here, and hopefully we will see all of you again. And thank you, Ingvar, for joining me. And I'm looking forward to seeing you all again very soon. Thank you.
Thank you all.